listen to today's program. It's very enlightening and very educating. We're educating women as well. And if you thought you knew everything about breastfeeding, you might learn something new today, or it's information you could pass on to other women. Breastfeeding is lowest in the Northwest and Southwest zones. Any reasons for that?
Well, for the combination of reasons, if it's an urban setting, they have their own reasons for urban setting, because the mothers obviously have to go back to work. If it's a rural setting, it could be cultural reasons or the community. So in each community, they have different rules and different laws and traditions, and they follow. So I will speak on the community level, and I will hand over to Dr. Luther to speak on the urban level. So on the community level, there are different reasons for it. So, for example, maybe the mother-in-law. Now, the mother-in, the two key factors when a woman gives birth is her husband and her mother-in-law usually, or her mother herself.
Right.
So it could be that, because of traditional practices that happen, our mothers and their mothers and their mothers have been used to supplementing. So they breastfeed, and then they include other things like water, as Blessing who just called in. So they will say to you, they will encourage the new mother, oh, he's not actually getting enough, give him water, okay, give pap, or give this. So there are different things that they introduce. So the support system, as Dr. Olayinka said, is very important, because if the mother is aware, the support system also needs to be aware, because they're usually the ones that pressure this women into introducing other things apart from exclusive breastfeeding. So that's from the community level. And then also the practices. There are actually some cultures who believe that, breastfeeding alone, that, we're Nigerians, so we have different tribes and cultures. So I don't want to get into it, but there are different cultures and different traditions that believe different things about breastfeeding. So those also play in to women not actually breastfeeding on the community rural level. Now I'll hand over to Dr. Luther to focus on the urban level.
So there's several factors in the urban settings. Normally in urban settings, women are more educated. So more of the jobs that women hold in urban settings are in the formal sector. Whether it's blue collar or white collar, it doesn't matter. They're in the formal sector, and they can't be carrying their babies on their breast.
Right.
Places like that.
Yes.
In rural areas, they're more informal.
We know breastfeeding is an important thing, but we wanted to bring the power of the private sector and the power of the public sector into a partnership where everybody's
together.
Yes, yes. Working together rather than just
women who are not lactating as they should, or when the woman dies, there are banks, just like blood banks,
right?
And then even special babies like premature babies that are too weak to suckle, they can't. They're so light. Some of them are like 7 months old. They can't even grab a nipple. Those kind of people, when there's milk in the milk banks, they can be sent into the baby, sometimes through nasogastric feeding.
Now, are there any milk banks in Nigeria as we speak?
No. And it's sad because they are already in 37 countries. There are over 500 million banks.
Does that include Africa?
In Africa, yeah. South Africa, so several. So this is one of the things we need to talk about. The private sector needs to come into town and say, look, this can be a business. We don't want to talk too much about making it like a business, like it's healthcare. But the truth is, these banks have to run on something, right? And so the public-private partnership on breastfeeding will come together, and specifically want to make sure the banks, the milk banks, are in hospital settings. We don't want them on one high street where we want there to be like a pediatrician that can easily come and talk.
Yes.
The gynecologist. It has to be as close to a healthcare facility as possible.
If you've just tuned in, you're listening to We Woman here on We FM 106.3. The time is now 14 minutes after 2. I'm Terry Pardew in the studio. We're still talking all about breastfeeding. Okay, so before we had the phone call, I wanted to talk to Dr. Olayinka, because she is a mom, and your child, I believe you told me earlier on the program, is about 9 months?
Yes,
9 months now. So you are a breastfeeding mom. Yes. So, oh my God, this is going to be interesting. Let me set up. So I want to hear all about your breastfeeding experience.
Okay, I think one of the things, just like the last caller just said, is she didn't want to breastfeed. One of the things before you breastfeed is you need to make up your mind. I'm going to do this. It's very important, especially if you're a working mom. And if you look at your support system, most of the time we don't have the right support system. You see families, oh, I didn't do it, why are you doing it? Just a waste of time. But the benefit, so many people are not educated on this, and that's why we're here to create more awareness. So the first goal is determination. You must have that because it is the key to the success of exclusive breastfeeding. So then again, technique, it's a skill. Breastfeeding is a skill. It's not something you think you can do it, you see people doing, because it's important. Proper latching, when you make sure that the baby's mouth truly covers about 3/4 of the areola, so that you know he or she's getting the milk down, and that